So, thanks everyone. Can I just take the opportunity to remind everybody that how important it is to come forward and be tested as soon as you develop any symptoms of COVID-19. Unfortunately, we are again seeing examples of times where people have had symptoms for 2, 3, sometimes 4 days, and they're not taking that early opportunity to come forward and get tested straight away. The most simple thing that people can do in terms of whenever those symptoms first start, whether it be the sniffly nose, the loss of sense of smell, or runny nose, cough, cold symptoms, and also gastrointestinal symptoms and diarrhoea, that upset stomach, please come forward and get tested straight away and don't delay. So, as I said a minute ago, we are unfortunately seeing examples of where people are leaving it too long, and that means that it's exposing a number of other people across their households and different settings to potentially contracting COVID-19. So please, as soon as you get any symptoms, come forward straight away and don't delay. I'd also like to take the chance to remind people about getting vaccinated. At the minute, our numbers are continuing to climb pleasingly for the Shepparton area and more broadly across the state. So at the moment in the Shepparton area, we're sitting in the middle 85–86% for people who've had a single dose, and 46 or 47% for people that have had a double dose. And that's starting to slowly increase and has done so over the course, particularly in August and early September, when the outbreak here in Shepparton was at its highest. But unfortunately, in the last week or two, we have seen a tapering of people coming forward for vaccination. There's plenty of access to vaccine appointments, both at the state-run facilities at the Macintosh Centre, across all of our partner health services in the region, from Kilmore, Seymour, across to Benalla, right up to Cobram and to Kyabram. There is plenty of access at those state hub and spoke sites, but there's also plenty of access at general practice and pharmacies as well. In the last few days, we've seen a really significant milestone that's been achieved for our region and our area, whereby over 200,000 doses of COVID vaccine have now been administered. And roughly speaking, that's been 100,000 in the state-run clinics and 100,000 in the primary care and community pharmacy clinics as well. So again, plenty of appointments, coronavirus.vic.gov.au, or the Health Direct platform through the Australian Government, where you can find out which general practices and pharmacies are now administering vaccines. So again, that's something really simple that people can do to help reduce the spread of COVID, is to get vaccinated. It helps protect not only individual people, but all of everybody's loved ones and the broader community as well. So quite simply, get vaccinated and get tested as soon as you experience any symptoms of COVID-19. In relation to the Shepparton outbreak, there is 7 active cases at the moment in Shepparton, and they're all in terms of community cases. There are some patients that we do have admitted in at GV Health at the moment. But of those 7 cases, there haven't been any new cases in the last 24-hour reporting period. Those 7 cases are across 4 households, and 2 of those households are linked. What we do know about some of those cases is, unfortunately, there has been incursion from people travelling across boundaries or areas that they shouldn't have, and that's resulted in some transmission locally. And again, just reinforces the message of, as soon as people get symptoms, no matter how mild they are, they should come forward and be tested. So the acquisition sources for 1 of 2 of those cases is still being investigated, but as I said, we know that there has been some incursion across travel boundaries. So I'm happy to take any questions.
Are you expecting more cases in the coming days?
Yeah, already today, and these cases will be reported tomorrow. We're already seeing a small number of people again testing positive. 2 of those cases are linked to existing households, and 1 is a new case that's still being investigated by the contact tracing team. And just in relation to contact tracing, It's a difficult job and it's a challenging job right across the system, not only at GV Health's public health units but across all of the public health units, whether they be the ones based in the health services or centrally. It's a tough job. It takes a lot of patience and energy, but in order to make it an easier job for the contact tracers to do, they actually need to rely on people cooperating and providing the right information and freely providing that information to the contact tracing teams when they do call, because that's obviously going to help us get to the bottom of the outbreaks or the new cases in particular, and allow us to provide information more quickly and more accurately to the community more broadly. So if anyone from the contact tracing team is contacting you or calling someone else in your household, please make sure that you provide the information as quickly and as readily as possible, because it's only going to help the broader effort in terms of the pandemic and containing spread of outbreaks at certain locations.
So that's 3 cases that are expected to be in tomorrow's numbers?
There'll be, at least 3, yep. Yes.
In terms of more venues, are we expecting more exposure sites to be listed over the coming days, or do we feel like we've kind of got around it at this stage?
I think it's more than likely there will be more exposure sites, and again it comes back to that's the importance of the contact tracing effort. So as soon as that information can be made available to the contact tracers, they're feeding it through the system so that it can be published on the coronavirus.vic.gov.au website. But yes, I think there will be some more exposure sites coming forward.
Do we have an idea on the amount of people isolating at the moment due to whether they're direct contacts or secondary contacts?
Pleasingly, it's not as many as we had a few weeks ago now, but it's would be somewhere in the order of about 40 to 50 people, I suspect, at this stage. I don't know the exact numbers, but it's nowhere near in the thousands, thankfully, that we experienced a few weeks ago now.
What would you say to people concerned this could turn into a similar outbreak to what we had recently?
So the cases that have started, the new cases, so we did manage to close out the outbreak from August through to September. But in relation to these cases, pleasingly we haven't seen quick or rapid spread at this stage, and that's partially, I think, due to the fact that there's a greater level of vaccination now in the community. Generally, people are doing the right thing, but there's always room for improvement. Hence the message of as soon as anyone gets any symptoms, to get tested straight away. It probably feels a bit better at the moment than what it did at the early stages of the August-September outbreak, but as we know with COVID, and particularly with the Delta variant, you're never really out of the woods and things can turn pretty quickly. So I guess most of us that work in health are pretty conservative by nature, and we're still anxious to make sure we get on top of this as quickly as we can to limit the impact to the community.
We've spoken about during the last situation just the spread among young people. With some students going back to school next week, how important is it for people to actually come forward and get tested, as you say, to avoid similar situations?
Yes, I think it's a good point about young people, and particularly with school going back. But there is, in addition to the getting tested straight away as soon as any symptoms occur, there is vaccination now available for primarily all of secondary school age children, and the roadmap that the Victorian government has set out is pretty clear in terms of which grades and year levels will return to school next week and beyond. But really, again, it just reinforces there is vaccination now available for children as young as 12 and above, so anyone who is eligible should be making an appointment to be vaccinated straight away.
In terms of exposure sites, we've had a few questions that have come through me about people trying to clarify, if you get popped up in an exposure site, say, tier 2, you get tested immediately or as soon as possible?
Immediately, yeah. We did put some information out on our Facebook page yesterday about all of the exposure sites, the definitions in terms of tier 1, 2 and 3. But as soon as you get notification, particularly for tier 1 or tier 2 sites, you should get tested straight away. There's no, again, it's a bit like as soon as you get symptoms, don't don't put it off. If you've been at particularly a tier 1 or 2 site, the risk is higher that you could catch COVID-19. So of course we want to know that if that's the case in terms of protecting people's health and well-being, but limiting the spread of any subsequent outbreaks or virus transmission among people in the community.
And the 7 or 10 cases now, are they all linked together, or they're still in 2 distinct groups where they're not linked?
No, so of the 7 cases that we're talking about in today's numbers, there's 4, they're across 4 households, and 2 of those households are linked, but 2 are not. And then of the 3 cases that we've seen so far today, 2 of those are linked to existing households and 1 is not.
And in terms of the incursion, is that an incursion to Melbourne?
Melbourne, yes, and parts of, we think at this stage, given our proximity to Mitchell Shire as well, and the route of travel and traffic, that there's a link definitely at this stage, it appears, with Mitchell Shire.